Welcome to the Dermatology Studio with Dr. Yusra Ayaz.
You've probably heard of seborrheic dermatitis, maybe as dandruff or even cradle cap. But what's wild is that this one condition can show up in so many different ways. It's not a one-size-fits-all thing. So today, we're going to break down its different clinical personalities, you could say, and see how it changes based on where it is and who has it.
All right, so here's our game plan. We're going to tackle 6 key forms. We'll kick things off with something called Sebopsoriasis. It's this interesting overlap condition. Then we'll jump to how it shows up on the face and the torso. After that, we'll cover the classic cradle cap in babies, what it looks like in adults, and we'll wrap up with a look at a much rarer, more widespread version.
Okay, let's get right into it with our first one, Sebopsoriasis. And yeah, the name kind of gives it away, right? It's like this fascinating mashup, a version of SD that shares a lot of features with psoriasis. So what's going on here? Well, it's literally an overlap of 2 different things happening in the same spot. Think about it. You've got seborrheic dermatitis, and then psoriasis decides to crash the party, flaring up in the exact same places. So you might be wondering, how can you even tell the difference? Well, the clues are in the scaling. It's usually coarser, more sharply defined. Sometimes it gets thick and even silvery, which is a total classic sign of psoriasis. The inflammation is dialed up a notch, too. There's actually a name for this, Koebnerization. It's like the SD just rolls out the red carpet, creating the perfect setup for psoriasis to show up. And this is where it gets really telling. This specific variant has been seen to pop up in HIV-positive men. That's a huge clue, right? It points to this really powerful connection between what's happening on the skin and what's going on with the body's immune system. Okay, moving on from that hybrid version, let's talk about the face. This is probably one of the most common and, most noticeable places for SD to appear. It turns out SFD has its favorite spots on the face. It really likes to hang out in skin folds, like those lines that run from your nose down to your mouth, or right in the creases of your ears. But you'll also see it on the eyelids, that spot right between your eyebrows, and on the inside part of the eyebrows themselves. And it doesn't always look the same, not by a long shot. On one hand, you might just see some fine flakes and a bit of pinkness around the nose and ears. But then you look at the scalp or in a beard, and it can be a whole different story. Everything from mild, grayish-white scales to a really inflamed situation with thick, yellow, greasy scales and crusting. And unfortunately, it's not always just about the skin. Facial SD can set off this whole chain reaction of other problems. For instance, if you get inflammation on your eyelid margin, that's called anterior blepharitis, you end up with flaky bits at the base of your eyelashes that can irritate your eyes. That can even lead to the loss of glands that keep your eyes moist, causing dry eye disease. And in the ears, well, that scaling and inflammation can turn into an outer ear infection, which can get even worse if bacteria or fungus join the party. All right, let's shift gears and move down to the torso. Here, we see a couple of different patterns, and these seem to show up a lot in men. So on the chest, you can get these 2 totally different looks. There's a localized version that often shows up with these really unique, kind of petal-shaped spots. But then it can also go big, spreading out to the upper back, the belly button, the armpits, and other areas where the skin folds. And the story doesn't end there. In those large skin folds, the skin can take on this shiny, pink, glazed look, sometimes with hardly any scaling. There's even a more fiery, widespread version called pityriaciform SD that covers the torso and sometimes the arms and legs. It can also affect the anogenital area in both men and women. And get this, one study on women with a specific type of vulvar dermatitis found that a full 40% of them also had SD somewhere else. Okay, let's talk about one that tons of parents will know instantly. Infantile SD, or as pretty much everyone calls it, cradle cap. Yep, it's super, super common in little ones. And when I say common, I mean it. Check out this number. Something like 72% of babies get cradle cap in their first 3 months. That's a lot. It really puts into perspective just how widespread this is. But here's the good news, and it's a big relief for parents. Cradle cap is usually just a temporary guest. It follows this really predictable path. It shows up around the 3-month mark, and then poof, it's usually gone all by itself by their first birthday. So what does it look like? The classic spots are cradle cap on the scalp or what's called napkin dermatitis in the diaper area.
But it can also pop up on the eyebrows, around the nose, and in those chunky baby skin folds. One important thing to know is that in kids with darker skin, it might look a little different. Maybe some mild redness, flakes, and even some lightening of the skin. And of course, it's crucial for doctors to make sure it's not atopic eczema, which can look similar. All right, we've covered the babies. Now, what about seborrheic dermatitis in adults? This is a different beast altogether. Unlike the here today, gone tomorrow version in infants, for adults, it's often a long-term thing, and it's frequently tied to other health conditions and risk factors. So in adults, SD tends to show up in the oilier areas of the skin, and it often doesn't come alone. It can be seen alongside things like acne and rosacea, and even fungal issues like athlete's foot or fungal nail infections. When we look at who gets it, a few patterns emerge. It seems to become more common as people get older, and men seem to get it more often than women. And while it's reported more in people with fair skin, that could just be because it's tougher to spot in darker skin. And then there's the massive connection to regular old dandruff, which is basically just a mild form of SD and affects like half the adult population. Remember how we mentioned the immune system earlier? Well, this is where that link becomes crystal clear. Look at these numbers. In the early stages of HIV, the rate is around 35%. But in someone with AIDS, that jumps to a staggering 85%. You see the same pattern with organ transplant recipients. The longer they're on drugs that suppress their immune system, the more likely they are to have HID. And here's one last really interesting connection: neurological diseases. We see higher rates of SD in people with Parkinson's, spinal cord injuries, and Down syndrome. So what's the connection? The theory is that it comes down to a lack of facial movement. With less movement, the natural oils or sebum don't get cleared off the skin as well, which basically creates the perfect breeding ground for SD. Okay, on to our last variant. This one is rare, thankfully, but it's a much more severe form of the condition, where it goes from being a localized issue to something much, much bigger. So, while it doesn't happen often, SD can sometimes morph into something called exfoliative dermatitis with erythroderma. And this is a serious whole-body inflammatory condition. We're talking about the skin all over turning red and literally starting to peel off in layers. So after looking at all these different faces of seborrheic dermatitis, from cradle cap on a baby, to that psoriasis-like hybrid, to the way it flares up when the immune system is down, it really makes you think, doesn't it? It leaves us with this big question about the incredibly complex dance happening between our skin, our immune system, and our overall health. It's all connected in ways we're just starting to understand.
Thanks for watching. Hit like, share, and subscribe to the Dermatology Studio. Ask your skin queries in the comments below.